Good morning, good afternoon, good evening, depending on your time zone. I bring you good tidings from Lagos State, Nigeria. If today is your first day coming across my video, you're highly welcome. I'm Marella Herbal Fertility. Today, I want to talk about PCOS because I've been getting several requests to talk about PCOS. So, what is PCOS? PCOS means polycystic ovary syndrome. It's a hormonal disorder causing enlarged ovary with small cysts on the other edges, on each edges of the ovary. So, how do you know that you have ovarian cyst? First of all, you start seeing signs and symptoms. What are the signs and symptoms? Infertility. You find out that you've been trying for over a year, but you're not conceiving. Mood changes, pimples, fatigue, excess body hair or hair growth, or you find out that you are growing hair under these places, bed like a man. Overweight or weight gain, find out that you're adding too much weight or you're fat. Ovarian cyst, irregular or missed period, hair loss, you find out that you are losing your hair. You are losing your hair regularly, pelvic pains, heavy bleeding. Some will experience bleeding a month, 2 months. That's a sign. Low libido, so on and so forth. So, what do you do? How do you detect medically that you have PCOS? You go for hormonal profile test. They will check your LH, they will check your FSH, they will check your MAH. Yes. Is either you don't ovulate or you were forced to ovulate but your body failed to produce the progesterone needed for the womb for implementation. Yes. For those forcing themselves, they have symptoms of PCOS, they go to hospital and the doctor recommends Clomid or Latrizo. It's very, very wrong, because when your body is forced to ovulate, it will cause, you will ovulate actually, but your body might fail to produce progesterone needed for your womb for implementation. Thereby, when such thing happens, it makes you to start forming cysts. That's why you see so many women with PCOS having cysts. Yes. Please, you guys should stop taking Clomid or Letrozole. Like, there's a lady I'm treating now. She's a PCOS patient. She went to hospital and she was given Letrozole. Can you imagine, this girl is still bleeding for 2 months? On the second month was when she contacted me. What am I saying? You don't force your ovary to ovulate. How do you do that? You first of all go for that hormonal profile test. You will know whether you have PCOS. If you run LH and FSH and you find out that the value of FSH is about 3 of LH, that means you have PCOS. Also, if you run AMH and the value of your MAH is about 3.5, that means you have PCOS. Please, if you do notice all these symptoms that I mentioned before, go for hormonal profile test first so that you will know the type of PCOS you have. You don't just treat blindly. Know the exact PCOS that you have. Your own might be minor, why some might be major. Your own might be that you don't have hormonal imbalance, just that you don't ovulate. Why some don't ovulate and they have hormonal imbalance? That means your own PCOS is major. So it's good to try and know the exact PCOS so that you don't make your situation worse. That's why I introduce my PCOS remedy to treat all this problem. I have the one for people that their own is minor, and while I have the one that their own is major. So try and know the difference. Until I see you next time, I remain Marella Herbal Fertility. See you next time.